So for whatever reason, a lot of healthcare providers are not paying attention to the interconnectedness of each of these three sides of the Triad of Health. They're intimately related. As an applied kinesiologist, I pay attention to how a person walks, how they bend, how they grind their teeth, how they chew, how they swallow. I watch how they walk, how they stand, how they bend and twist. Because these things people do every day, don't they? And so if I'm not paying attention to them, it could be that I treat them and do a great treatment, but because they're bending, because they don't, because the stress of bending, chewing, grinding, and swallowing, and walking, and standing is too much, the treatment doesn't last as long as it should. So this is crucial. A person might have something about the way their facial structures are that shows that they're at a high risk for heart disease. I should probably pay attention to that. A lab might be done one day that shows not a whole lot. A blood lab might be given to me by one of my patients, and it doesn't really reveal too much. Maybe there's a slight increase in white blood cells, a very, very small infection or something like that. Not a big deal. But that lab might have been done 3 or 4 weeks ago. The person might have changed a lot in the last 3 or 4 weeks. How am I going to diagnose a person through a piece of paper that was taken from their body 3 weeks ago that looks for a disease? I thought you might want to know, since you're watching this and you're interested in health, the blood labs are only able to diagnose pathology, disease, dysfunction, or a high risk for one of those things. They don't diagnose health. They don't diagnose normal function. If there's a lot of people could have cancer, it doesn't always show up on a blood lab. So for me to take a lab, a sheet of paper, and try to diagnose a person with the sheet of paper, it's strange to me. Why not focus on the person that's in front of me? If I had my patient here in the room, why not diagnose the patient? Why not check to see how their muscles function, how they walk, chew, bend, grind, swallow, whether or not they taste certain things, how, look at their facial structure, notice the color of their skin, check their feet, see if they have painful areas in their body that relate to certain glands and organs that are known reflex points that they've linked back to the papyrus papers of Egypt thousands and thousands and thousands and thousands of years ago, that they know we're connected then. If we know that these things are all related, and we know there's a known science behind this, which there really is, then why not use the science that we have available to us? Instead of just staring at labs, which may or may not be accurate, may or may not reveal what we're looking for, let's look at our patients, is all I'm getting at. So thanks very much for coming to the Triad of Health website here and taking a look at what we're talking about, so you can learn more about some of your options when it comes to the current healthcare situation that we have in the United States.